a window into other potential issues.
I found out I'm inside here just a lot. I'm a child. I'm a child. Because to me, I am not.
So what does this have to do with the kids?
Because when I'm in church, and everything, there's a reason I was either took it, by my grandma talks like with the London accent.
She was avoiding the whole kid situation, and I was trying to hone her in and try to understand, one, is she mentally ill? Two, is she telling the truth?
Back when I was growing up, I remember white tigers.
White tigers?
White tigers, okay? Beautiful white tigers. There was a white mama tiger that wouldn't let me go nowhere. She would let me out of her sight.
What kind of food does the tigers eat?
Peanut butter or cheese.
Okay, I heard they like cheese and peanut butter.
She honestly believes in what she's saying. She's convicted in what she's saying. We're trained to identify certain emotions that trigger deception. For example, if she's telling me that she loves her kids and in her face she's showing like disgust, that's a no fit, and those are the things we're looking for. As she's talking, she's showing an upper body fear, a lot of distress, a lot of heartache, so it's a fit. I'm not a mental health professional, but you could tell that, there's some type of mental disorder.
Jamie is just one of roughly 500 inmates that shows some form of mental health issue. A rising tide that has led to an intervention team, specially trained to deal with inmates in emotional crisis. And a separate unit reserved for the worst off, those deemed a danger to themselves or others. This is the second floor of the North Tower, a world less like a jail and more like a mental health hospital, filled with inmates displaying signs of serious mental illnesses. And many are repeat offenders, like Lance Marshall.
He grew up in the house. To be honest, raised by the streets. To live at 18, yeah, everything we need. Lord God will forgive me for all the things I do, because I'm in the head and he kept a couple screws.
Seriously, why are you wasting your time with that when you can learn a foreign language and do a murder contract in a foreign country? Rap music is giving you all the wrong tips on how to commit crimes and get away with it.
What about R&B? Like R&B?
I listen to foreign language programs to get educated because that helps me a little bit more than rap music. I feel extremely out of place in the psych unit because I'm somewhat well read. I've gone to college for approximately 7 years, studying many disciplines superficially, and most of these people can hardly spell their name. It is rather like a fish out of water. I mostly just berate and yell at the inmates for their petty criminality, and it's rather hypocritical of me. Honestly, look where you are! Rap music gave you all the wrong tips on how to commit crimes and be a good criminal. Try the library.
Both y'all eat it. We all eat it. We all landed in the same spot. I know that's the part of the black.
Doing time in Clark County Detention Center is embarrassing for me because I feel like I've disgraced my family. My passion is to show the world what an intellectual narcissist I am and prove to my family that I'm not a disgrace and humiliation.
Lance Marshall has battled mental illness since his teen years and is a diagnosed bipolar schizophrenic. But it's a fascination with illegal weapons that keeps him coming back to jail.
I'm here at CCDC for possession of brass knuckles. I've been to Clark County Detention Center approximately 5 times, 3 times for weapons charges, and another time for beating a police officer. Okay. I was approximately 16 years old when I started experiencing mania and schizophrenia, though I didn't believe at the time, and it took many years after that for me to finally be convinced. What's the difference between criminals and terrorists, man? Terrorists go on to form governments. Criminals just rob them. After 6 years after I was busted by the police, I went to a mental hospital / correctional facility. I started taking medication, and at that time I realized that the delusions I was experiencing in no way could be real.
It seems incarceration may have helped Marshall come to terms with his illness. But schizophrenia still impacts his ability to make good decisions, staying away from illegal weapons and drugs. It's an ongoing struggle that he'll confront again in 6 days when he leaves jail.
I'm terrified that I might become a homeless, substance-abusing transient. Because the last letter my mom wrote said, when I'm dead, what are you going to do, Lance? You keep on coming to jail, mental hospitals. Are you going to survive without your mother? That's a terrifying thought. Terrifying.
Fear of the future is a common theme in jail, where guilt or innocence hangs in the balance. And for inmates like Roy Washington, mental illness only compounds the pain.
Hey, Mama. Good. I went to court today. They told me to come back and do it.
Roy is accused of committing a burglary. And while he hopes to have probation instated, his court date is still 2 weeks away, and his future is uncertain.
I'm trying to stay strong, too. Yeah, that's a problem.
I was hurt. Came back to the cell. Even shed some tears about looking at my family pictures.
I know I gotta change. It ain't nothing that'll take a week or two. It's slowly happening.
I wanted to inflict, open back wounds on my arm and do that again because I was hurting so bad.
Roy Washington has a long rap sheet of petty thefts, matched with schizophrenia and depression. He's also known as a cutter, something he says he's been doing since an early age.
I first started cutting myself when I was like 6 years old. It's just something like next to ventilating. Releases all the confusion, your loneliness, and your anger. But then 10 minutes later, you're feeling the same thing. So then you're back cutting yourself again. It's like an addiction.
It's a behavior that makes Washington an especially tough case, and one that may be getting tougher. His last jail stint ended with prison, where he took the cutting to a new level, trying to take his own life.
I knew that when the guard would see it, he was gonna lock me up. So what I did was I got two blades. So I put one under my gum on the side of my mouth. Because once you slice your wrist, the blood just don't trickle out slowly. It's just like... So once they got everything wrapped up and stapled down, they put me in a room by myself. I unwrap everything, get the blade, and do it again. But they have the cameras there. But once they seen I wouldn't get rid of the blade, they had to strap up and come and shoot you with the needle. So when you wake up, you're all shackled up and you can't move. When I talked to my family about it, they said that, don't let the devil tempt you. Try to do something that's going to prevent you from hurting yourself or hurting your celly. So I'm going to read my books, continue working out my celly, playing cards, looking out the window, and hopefully that'll just blow by time until I go back to court. But it's hard, it gets hard.
Roy has 2 weeks before he goes back to court. 2 weeks to control his thoughts in hopes of getting back home to his family.
The U.S. Marshals have asked for your help in finding this fugitive. In 1997, David Benjamin Creamer was indicted by an Arizona grand jury on 23 counts of criminal activity, including distribution of child pornography and obscene materials. He's been on the run ever since. Please call the U.S. Marshals at 1-800-336-0102. This guy we have to get.
Do you suffer from back pain? Try Dr. Ho's Back Belt, a back pain solution that is now covered by many insurance plans, even Medicare.
The belt allowed me to walk for the first time in a year with a cane.
Dr. Ho's Back Belt is a patented decompression back brace designed to relieve back pain. It expands to stretch tight muscles and traction your lower back, all while providing strong support. If you have back pain, Dr. Ho recommends you try his belt, even if you suffered for many years.
Since I started using the belt, I felt almost instant relief. After about a half an hour of using the belt, the pain diminished a lot. And Now it's all gone.
Doctors recommend back braces for chronic and acute back pain, degenerative discs, herniated or bulging discs, sciatica-related back pain, trouble sleeping due to back pain from sitting, driving, or lifting, and back pain from sports and exercise.
I think every patient with back pain should be wearing this belt.
Imagine finally getting relief for your back pain and being active again.
I've had back pain problems for the past 4 or 5 years. Nothing gave me instant relief except for the Dr. Ho belt. Before I couldn't really move, couldn't play with the kids. And now after using it, I'm young again.
So if you have back pain, have your Medicare card available and call us now. Our operators can check if you're eligible to receive your very own Dr. Ho's back belt at little or no out-of-pocket cost. Get back to living the life you love. You can wear Dr. Ho's back belt while walking, relaxing, driving, doing housework, lifting, playing sports, and even while sleeping. Just pump it up and feel the relief.
Really working. It's already beginning to relieve my back pain, and I can feel it really stretching the tight muscles in my back. And I can't believe how good it feels.
Call now. You deserve to get relief from your back pain. And if you're eligible, you may receive your own belt at little or no out-of-pocket cost to you. You'll get Dr. Ho's back belt, easy-to-use hand pump, and back rehabilitation DVD. This is a limited time offer.
Call now to get relief for your back. Back pain doesn't have to limit your life.
At Clark County Detention Center in Las Vegas, Nevada, mental health nurse practitioner Virginia Singer is checking in with a regular here, Jamie Hoyt. Part of the jail's ongoing efforts to get inmates like Jamie the treatment they need while in custody.
Tell me your understanding of the competency evaluations.
Frequent observation is also part of a process that helps determine whether inmates are competent to stand trial.
May I see the drawings? Just want to take a quick look at those.
It's an evaluation that could set off a path towards treatment, or, if Jamie's found competent, up to 4 years in prison.
Doing 80 ball methamphetamine a day really doesn't help. I mean, that's $300 worth of drugs. That's just bad.
But her addictions make for a complex picture.
Jamie is just one of many here in the jail with bipolar disorder. A couple of times when she came in here, she was still under the influence of methamphetamines. Right now, she's been here in the jail long enough that probably what we're seeing is not related to the methamphetamine use.
All right, God bless you, man.
Unfortunately, sometimes when they're still under the influence, they can often mimic the manic phase of bipolar. It can mimic someone with schizophrenia. It gets a little hard to sort things out.
Sorting things out begins from the very first moment a new arrestee walks in the door, where officers and bookings screen for signs of both intoxication and mental illness.
Do you feel like hurting yourself? Are you suicidal?
Is this a joke?
Oftentimes, mental illness and addiction go hand in hand. It's kind of hard to tell which one starts first.
Booking is often the fork in the road, where intoxicated inmates head for the detox tanks. And after coming off their high, those showing the signs of mental illness will be going down one path, while others, the addicts, set off on a path that could lead towards treatment of a very different kind.
I come to jail at the same time every year for some reason.
How do you keep coming back to jail?
It's just drugs. It's drugs.
Nina Dickin is a regular at the jail. Back in after drug use led to a probation violation. She is now facing the possibility of prison time on her original conviction, holding a 16-year-old against her will while on a heroin bender.
I hate myself when I'm high. When you're on heroin, there's nothing else. You don't care about anger. Probably when I was like 12 or 13, I started drinking, stealing alcohol, and smoking weed. Then I got pregnant when I was 15. And had my son a day before my 16th birthday. I was clean until I was 18. And then I started doing speed. And then probably right before I turned 19, I started doing heroin. My mom did heroin my whole life. I hated my mom for doing it for a long time, but you learn to accept because she's your mom. So I learned to accept her. She's a good person, but she has a bad habit. I don't want my son to think of me how I thought of my mom when I was 10 years old. I don't want my son to be like that. I don't think about that every day.
addicts like Nina, this is the start of a path towards treatment or incarceration. And also a cutoff from the outside world and its temptations. There are no contact visits here.